You will also find me do assessments as far as, so as minor, which is about 60% of people, depends on the study that you pull, and pelvic alignment. So sometimes when I'm doing testing for the legs, everything is not firing properly, or something in the hip complex is a little out. We can get more into details of how I assess that another time. So when I'm doing that, I will actually find, so a lot of people who chronically have that lordotic arch when they're lying in this position, or an excessive amount of compressive apical breathing, anxiety, that kind of stuff, may benefit from a specific deliberate pressure here, which is about a 1.5 maybe. And then if you're okay with it, I'm just gonna put pressure just above the pubic bone, okay? So this is why I would normally do this without the fold, or the linen fold, so I can actually not go through multi-layers. And so see what I did? I put my hand as a barrier, and as I was working down, I almost pulled the skin towards me. So I was pushing down a little bit and just traveling safely. So not only have I created a safe comfort line, it does not feel like I'm like searching for something inappropriate. So as I do this, I will push gently against the top of the pubic bone. Is that okay there? Is one side more unpleasant than the other? Left side. That is right, so I'm interested to see what that is. That's okay. And so I will just have him breathe into both of these places. And I will use this in conjunction with the hip assessment that I will do as well. So bring it back into it again. All the way down. So our lower core connects to our pelvic floor muscles. And a lot of the times, our lower core is really difficult to engage. You will find that with a lot of people with low back pain, a lot of chronic abdominal tension, digestive issues, dysmenorrhea, that kind of stuff can play out. And so when there's chronic low back pain or really tight glutes, or someone comes in and their physio has told them they've got weak hamstrings, I'm looking at re-stimulating psoas iliacus, making sure that everything is engaged all the way down. That's better. You feel the difference in that? Yeah. So sometimes with this kind of stuff, all I'm doing is just giving stimulus for him to find that resistance against. So he wasn't breathing into his lower abdomen, into his in my lower hand. And so I just gave a little bit of shake, a little jostle, a little vibration kind of stuff to kind of stimulate into that area. And as he's breathing out and there's imbalance of tension, I'm kind of moving with that tension into those areas to kind of encourage them to release, and then allow him to engage into them again as he breathes in. So sort of gentle, coercive manipulation. Well, not something you guys are going to show? Probably? No. Great. So I'm going to do some psoas iliacus hip stuff and show you the stuff that I do in the weird way. I'll do this OP. Does anyone need to see anything else that's OP related or exam related for abdomen? Anyone have any questions? Yes.
Yeah,
Like abdominal
not this one, like the one that we actually can use on the OP.
Absolutely.
Okay.
So, what's the condition?
I don't
Constipation. Great. What is my treatment goal?
help them
Increase abdominal mobility? Perfect. So you saw me warm up the muscles, you saw me do some of the ringing, you saw me do some breathing. So as he's breathing into some stuff, I'm going to gently coerce into the abdominal muscles, so I can get a little bit of rectum, or rectus abdominis. I'm going to have good words at one point, right? So approximating against it, pulling in, I can get a little bit of stripping, a little bit of fascial release. Everyone's a little different, so it's sort of what you can find. So as I approximate the superficial tissues, I can get into the lateral aspects, the lateral connective tissue of that. I can do release broad to abdominal areas to create movement. What I'm essentially doing in this is I'm going to be doing motility related stuff, but I'm creating ease and flow of breath, movement, trying to create less areas of tension through the breathing and general aspects of movement. And as I go, I can go a little bit deeper into that kind of thing as well. And as I'm doing this and as he's breathing, I'm looking for areas of extra tension. So I'd say that he's got some in his right upper quadrant. You agree? Good. So I'm just going to do some fascial holds. Abdominal massage is not forceful. I'm never really doing anything forceful here. And what's the pressure on that?
Like pressure is like 1 or 2. The pain is like very good pain.
Okay,
Yeah.
so 3.
Yeah.
Right. This is why I have my differentiation of pressure and pain. And so I can individualize that a little bit. So I'm on rectus there. How's that as far as pain goes? Is that painful?
No, no, not really.
Tell me if you,
Good pain,
good pain?
light pressure.
Light pressure. What's that there? Sharper pain? Where? No. Good. So what else could I be thinking of when I'm looking at abdominal discomfort in the front here?
It feels like tissue stretching.
Yeah, tissue stretch. What am I in? What are the structures of my hand? Let's go muscles. Rectus abdominis. Transversus is deeper. External and internal obliques. Where else do those attach? Origin, insertion.
Right.
Yeah. Perfect. So I'm in an area that has tension. Some of it attaches to the lower ribs. I can create nice easy fascial pulls. See if there's tension correlated to the ribs themselves. Good. I can also, with consent,